A diet is a set of guidelines for daily food consumption. It is a crucial aspect of maintaining a healthy lifestyle, as what we eat directly impacts our physical and mental well-being. The food we consume is the primary source of energy and nutrients that our body needs to function properly. It also plays a significant role in the prevention and management of chronic diseases such as obesity, diabetes, and heart disease. The importance of a healthy diet cannot be overstated. Eating a balanced diet that is rich in fruits, vegetables, whole grains, and lean protein can provide the body with the necessary nutrients to maintain optimal health. It can also help prevent chronic diseases and aid in weight management. Moreover, a healthy diet is not only beneficial for the physical well-being but also for the mental well-being. However, the concept of a healthy diet can be confusing and overwhelming. There are many different types of diets, each with their own set of guidelines and principles. Each diet has its own set of pros and cons, and it can be challenging to determine which one is the best fit for an individual's needs and goals. It is important to note that a healthy diet is not a one-size-fits-all solution. What works for one person may not work for another. The key to maintaining a healthy diet is to find a balance that works for you and to make it sustainable. This means finding a diet that is not only nutritionally balanced but also fits with your lifestyle and preferences. Different types of diets. Each diet has its own set of guidelines and principles, as well as its own set of pros and cons. Understanding the different types of diets can help individuals make informed decisions about their dietary choices and achieve optimal health. Low-carb diets. Low-carb diets focus on reducing the intake of carbohydrates, which are found in foods such as bread, pasta, and sugar. The idea behind low-carb diets is that by reducing the intake of carbohydrates, the body will enter a metabolic state known as ketosis, in which it begins to burn fat for energy instead of carbohydrates. Examples of low-carb diets include the Atkins diet, the ketogenic diet, and the South Beach diet. The main advantage of low-carb diets is that they can lead to rapid weight loss and improved blood sugar control. They can also be effective for managing certain health conditions, such as diabetes and epilepsy. However, they can also be high in saturated fats, which can increase the risk of heart disease. Additionally, low-carb diets can be difficult to sustain in the long term and may lead to nutrient deficiencies. Low-fat diets. Low-fat diets focus on reducing the intake of fats, which are found in foods such as butter, oil, and meat. The idea behind low-fat diets is that by reducing the intake of fats, the body will lose weight and reduce the risk of heart disease. Examples of low-fat diets include the Ornish diet, the Pritikin diet, and the TLC diet. The main advantage of low-fat diets is that they can reduce the risk of heart disease. However, they can also be high in carbohydrates, which can lead to weight gain and blood sugar problems. Additionally, low-fat diets can be difficult to sustain in the long term and may lead to nutrient deficiencies. Plant-based diets. Plant-based diets focus on consuming a diet primarily consisting of plant-based foods such as fruits, vegetables, grains, and legumes. Examples of plant-based diets include vegan and vegetarian diets. Plant-based diets are often high in fiber, vitamins, and minerals and can lead to weight loss and improved heart health. They can also be beneficial for the environment. However, they can also be low in certain nutrients such as iron, calcium, and vitamin B12. Intermittent fasting. Intermittent fasting is an eating pattern that alternates between periods of eating and fasting. This type of diet is based on the idea that by reducing the time frame when food is consumed, the body will enter a metabolic state that burns fat for energy. Examples of intermittent fasting include the 5-2 diet, 16/8 method, and the warrior diet. The main advantage of intermittent fasting is that it can lead to weight loss and improved insulin sensitivity. However, it can also be difficult to sustain in the long term and may lead to nutrient deficiencies. Additionally, it may not be suitable for certain individuals such as pregnant women, individuals with a history of eating disorders, and those who are underweight. Mediterranean diet. The Mediterranean diet is a traditional diet that is based on the foods and eating habits of the countries surrounding the Mediterranean Sea. It is characterized by a high intake of fruits, vegetables, whole grains, nuts, seeds, legumes, and fish, and a moderate intake of dairy products, eggs, and poultry. The Mediterranean diet is also known for its focus on using healthy fats such as olive oil. The main advantage of the Mediterranean diet is that it has been linked to the reduced risk of heart disease, type 2 diabetes, and certain types of cancer. It is also high in antioxidants and anti-inflammatory compounds, which can have a positive impact on overall health. Additionally, the Mediterranean diet is easy to follow and can be sustainable in the long term. However, it can be difficult to follow for those who are vegetarian or vegan, as it includes moderate amounts of dairy and animal protein. Weight loss diets. Weight loss diets focus on calorie restriction and weight management. Examples of weight loss diets include Weight Watchers, Jenny Craig, and Nutrisystem. The main advantage of weight loss diets is that they can lead to weight loss and improved body composition. However, they can also be difficult to sustain in the long term and may lead to nutrient deficiencies. Additionally, they may not address underlying issues, such as disordered eating patterns and emotional eating. Choosing a diet. Once you have a general understanding of the different types of diets available, it's important to consider how to choose the right one for you. Factors to consider. When choosing a diet, it's important to take into account your individual needs, goals, and preferences. Some factors to consider include food preferences. It's important to choose a diet that includes foods that you enjoy, can realistically incorporate into your daily routine. Medical history. If you have any pre-existing medical conditions, such as diabetes or heart disease, it's important to choose a diet that is appropriate for your condition. Personal goals. Are you looking to lose weight, improve your overall health, or manage a specific health condition? Your goals will help determine the type of diet that is most appropriate for you. Consultation with a healthcare professional. It's important to consult with a healthcare professional before making any significant changes to your diet. They can provide personalized advice and ensure that any dietary changes align with your individual needs and goals. They can also monitor your progress and make any necessary adjustments to your diet as needed. Making a diet sustainable. One of the most important aspects of maintaining a healthy diet is making it sustainable. This means finding a diet that is not only nutritionally balanced, but also fits with your lifestyle and preferences. It also means finding ways to make the diet sustainable in the long term. This can include finding healthy substitutes for favorite foods, developing a plan for eating out, and finding ways to incorporate physical activity into your daily routine. Importance of finding a diet that works for you. A healthy diet is not a one-size-fits-all solution. What works for one person may not work for another. The key to maintaining a healthy diet is to find a balance that works for you and to make it sustainable. This means finding a diet that is not only nutritionally balanced, but also fits with your lifestyle and preferences. Final tips for maintaining a healthy diet. Consult with a healthcare professional before making any significant changes to your diet. Plan and prepare meals in advance to have healthy meals readily available. Find healthy substitutes for favorite foods. Develop a plan for eating out. Incorporate regular physical activity and manage stress levels. Remember that a healthy diet is only one aspect of overall health. It is important to have a balanced lifestyle.